Today I'm going to teach you one of my favorite injections of the Depressor Anguli Oris with tox or neuromodulators. So when you inject the Depressor Anguli Oris muscle, which is a broad-based muscle that pulls down on the corners of the mouth, when you inject that, it actually releases the corners of the mouth to move up into more of a smiling fashion. And this is a beautiful injection. Most patients are very well suited for this. In fact, you can have your patient grimace, as you can see I'm having a hard time doing right now. And and if they pull down on the corners of their mouth, they're typically a great candidate for this injection. There are a few different ways that you can do this, and they will all give you a beautiful result. So when you think about the Depressor Anguli Oris muscle, it's a muscle that starts at the corner of your mouth and travels in a triangular fashion and is a broad-based muscle just medial to this, and this is the most superficial of the three. So there's your DAO. Medial to this, you have your depressor labii inferioris, and if you inadvertently hit this muscle, you will knock out the ability of this muscle to pull down on the mouth, and so your patient will have an elevated side of their mouth. And then the last muscle that we think about in this area is the mentalist. So you can see I have my depressor anguli oris muscle, my depressor labii inferioris muscle, and my mentalist. And from superficial to deep, they run superficial depressor anguli oris. Mid-depth is your depressor labii inferioris and your mentalist. Interestingly, your depressor anguli oris muscle typically runs anywhere from 2 to 4 millimeters deep. So if you're using a traditional 8 millimeter 31 gauge BD syringe, then you would only need to insert that needle about a fourth or max a halfway depth. Okay, there are two ways to inject this muscle. Number one, and perhaps one of the most common, is have your patient grimace. See how I pull down? And you will actually angle your BD syringe at approximately a 45-degree angle, and you will insert your needle about a fourth of the way, and you will deliver typically 4 units. I find that 2 units does not impact this muscle sufficiently. That's one way that you can do it. The second way that you can do it is to draw a line from your nasolabial fold all the way down to where this intersects your jaw. This is a safe way to inject this muscle, and actually my favorite way, here we go, because um, when you inject here, you are treating the broadest portion of the muscle. So you know you're in a relatively safe space, and you are just going to insert your needle about a fourth of the way, and you're going to deliver 4 units. You know that you are so far lateral that you likely will not inadvertently treat the depressor labii inferioris or the mentalist muscle. And this will give your patient a beautiful result. This also will set you up if you want to go ahead and give your patient a Nefertiti neck lift, which we'll talk about in a different video. You are treating with your first injection point, and this gives a beautiful result. So this is my favorite way. And the third way is from this area where you draw the intersection, you can go 1 centimeter up and 1 centimeter medial, and you can treat there. So you can see how this is 3 very different ways to treat. Way number one, hide the grimace. Way number two, draw a line from the nasolabial fold down to where it intersects with the jaw. Way number three, from that intersection point, move up superiorly and medially 1 centimeter, and you can deliver neurotoxin there. But know that you likely need 4 units bilaterally to make any kind of impact on your patient.